Okay, there we go. Now let us continue to the next video. Okay, here.
We'll do a biopsy to confirm, but I'm confident that we caught it early.
This is terrible. I can't die. You need me.
I know. With surgery, radiation, and immunotherapy, the prognosis is excellent.
Immunotherapy as a noun means a type of cancer treatment that helps your immune system fight cancer. The immune system helps your body fight infections and other diseases. Let's look at an example. When I had cancer, the doctor suggested me to go through immunotherapy to get treated for cancer.
Hang on, guys. Before I go further, I would like you to please comment below and do let us know your favorite movies or TV shows so we can make lessons on your favorite movies. And don't forget to like and share this video if you are enjoying our lessons.
Prognosis is a noun and it means a prediction of the outcome of a disease or disorder. This term can either be used in general conditions as a statement of judgment, likely to happen in the future, especially in connection with a particular situation. For example, I was reading a gloomy economic prognosis in the paper this morning. Here in this statement, the term prognosis is used in the general situation, not in the medical term.
Okay, so we use the word prognosis. Okay, so what do we mean when we say prognosis?
Process. So, the patient, the patient prognosis, the doctor prognosis about condition, medical condition. He's he actually grasp the outcome that could appear after in the future. Yeah.
Mm. Okay, that's it. Okay, thank you very much, Doc, for your answer. Okay, so prognosis here, it is a prediction. Okay, let me make it big, Doc. Okay, it is a prediction of the outcome of a disease or disorder. This term can either be used in general conditions as a statement of judgment likely to happen in the future, especially in connection with a particular situation. Okay, so for example, Doc, can you give me a prognosis, Doc, please? Can you give me prognosis, please? Mm-hmm.
Oh,
For a blood disease.
oh, there are many blood diseases in hematology. So I think leukemia is a dangerous disease, blood disease, and the prognosis this disease is not good. The patient if have um, a child of leukemia and almost this and almost is not good. The person can if the person treated with with, if the person had a therapy, chemo, chemist therapy early, they could live a few years later, but you can but they could again disease
Yes, that's right.
and
Um,
not good.
yes, that is usually the sad thing about cancer. Okay.
Yes.
Yes, it is usually unpredictable, and risky. This one.
Yes.
Okay. So let us continue about the video.
Term, which means, I was reading a gloomy economic outcome in the paper. Next. If the cancer is caught early, the prognosis is excellent. Means, if the cancer is caught early, then the treatment outcome is always excellent.
This is terrible. I can't die. You need me.
I know. With surgery, radiation, and immunotherapy, the prognosis is excellent.
Fear and worry suck.
Oh,
Have you ever been frozen or paralyzed by fear? Well, I have.
okay, this one.
Is everything okay? The nurse told us you didn't finish the surgery.
Extensive is an adjective, and if something is extensive, it is very great. For example, the blast caused extensive damage, crushing the ground floor windows. Means, the blast caused great damage and crushed the windows. Next. The security forces have extensive powers of search and arrest. Means, security forces have great power of search and arrest. Abdomen as a noun means, part of your body below your chest, where your stomach and intestines are. It is commonly spoken as belly. Example. He was suffering from pains in his abdomen. Next. You have very extensive cancer throughout your abdomen. This means, you have highly spread cancer throughout your belly.
Suzanne, you have very extensive cancer throughout your abdomen.
Okay. So the word used, doc, is extensive. Let me check first. Extensive cancer. Extensive cancer. Okay. So can you tell me, doc, about this one? What do you know about extensive cancer? Specifically, blood related. Okay. This one.
Mm. Oh, the blood is a solution organ. So the cancer of blood is extensive cancer because leukemia is because blood is not isolated and they can spread on the body on the body and not yes. So leukemia is extensive cancer and their prognosis is not excellent, not good.
Not good. Okay. So this is usually the problem. Like for example, leukemia.
Yes, leukemia. The
Okay,
cancer
this is
of white blood cell.
yes, usually the one of the most dangerous cancer.
Yeah.
Yes. Okay. So now let us continue. Okay, this one.
It appears to be malignant.
Malignant is a noun, and a malignant tumor or disease is out of control and likely to cause death. If you say that someone is malignant, you think they are cruel and like to cause harm. Example. She developed a malignant breast tumor. Means, she developed an out of control dangerous breast tumor. Next. He said that we were evil, malignant, and mean. Means, we were evil and cruel. Last. The process by which malignant cancer cells multiply isn't fully understood. Means, the process by which out of control cancer cells multiply isn't fully understood.
Suzanne, you have very extensive cancer throughout your abdomen. It appears to be malignant.
Malignant.
And it appears to have metastasized around every organ.
Metastasize as a verb means to spread from one part of the body to another. If cancer cells metastasize, they spread to other parts of the body and cause tumors to grow there. Example: a checkup revealed a small tumor on his lung, but it has not yet metastasized. Means, a checkup revealed a small tumor on his lung, but it has not yet spread to other body parts.
We can't see the retrohepatic part of the cancer because of the liver. We can't see the retroperitoneal part because of the right kidney.
Yes, I know. That's why we should take out the organs.
Retrohepatic as an adjective means behind the liver. The senior doctor says, we can't see the retrohepatic part of cancer because of the liver. Means, we can't see the part of cancer that is behind the liver. Retroperitoneal as an adjective means the area in the back of the abdomen, behind the peritoneum. The organs in the retroperitoneal include the adrenal glands, aorta, kidneys, ureters, pancreas, rectum, and parts of the stomach and colon. The peritoneum is the tissue that lines the abdominal wall and covers most of the organs in the abdomen. In the clip, doctor says, we can't see the retroperitoneal part because of the right kidney. Means, we can't see in the back of the abdomen because of the right kidney.
You want to remove her liver and right kidney?
Yes, and also her left kidney and her pancreas and the intestinal tract and the stomach.
You do know that several of those organs are quite essential.
We'll put them back.
The pancreas as a noun means an organ in the body that produces insulin and substances that help to digest food, so that it can be used by the body. Insulin is a chemical substance that controls the amount of sugar in the blood.
Okay, so this one, Doc, let us go to ask some questions. Mm, um, there is a mention of the word insulin. Yes, and it is produced in pancreas. Okay. So, Doc, may I ask you, what can you say about the regulation of insulin in the blood? Okay. Can you tell me about it, Doc?
Actually, it's important um, important important uh, substance, hormone because insulin can release glucose blood level.
Mm-hmm.
It's a it's only hormone to decrease glucose blood level. So it's very important. Yes.
Yes. Okay. So how about what can you say about insulin resistance? This one.
Oh, insulin resistance when is a condition is a popular disorder in diabetes type 2. The is appear insulin resistant. It's a condition the person have a normal or high insulin level in blood, but the body can't use insulin properly.
Mm,
Yes.
okay. So, Doc, can we regulate it? Can we regulate it? How can we regulate it?
Oh, the person is should we often shows the person with diabetes, tip, type 2 is control their blood glucose level is by use drug, use insulin is
Okay.
insulin or controls their and have a lifestyle, good lifestyle.
Okay. So, Doc, for example, can exercise help regulate our insulin?
Yes, exercise is very important therapy
Mm.
to control insulin to control glucose blood level and stop the disorder of insulin resistance.
Okay. So, how about in your case, Doc? Let us change our topic a little bit. Do you love exercise?
Yes.
Oh, wow. What do you do? What kind of exercise do you like?
Oh, I often I like walking.
Walk.
Walking. Uh, sometimes I running, but I usually walking.
Mm.
And sometimes I do aerobic exercise at my
Oh,
house.
okay. Okay, okay. How about going to the gym? Do you love
I
going to the gym?
I don't like gym because I am my time is not flexible.
Ah,
So,
that's why.
I quite so busy in in I quite in so busy in evening and the morning. So I don't
Mm.
choice gym in
Okay.
gymnastic
Uh,
room.
okay. So, Doc, actually, I noticed that you are very busy. Yeah. So, what do you usually do in order to have a balance lifestyle?
Yes, it's not easy for me to have balanced lifestyle.
Yes, that's right, Doc. That's why you're really doing a good job. Okay. So now let us continue the video, Doc. Let me share my screen again. This one. So for Doc, is everything okay or do you have questions? Is everything okay or do you have questions? None?
No, no, no.
None. Okay, let us continue. Let me transfer it here. Okay, this one.
The intestinal tract is a tube or organ in the body, through which food travels from the stomach and out of the body while it is being digested.
We remove them, clean up the cancer, then put them back.
Ex vivo surgery.
It's been done for pancreatic cancer.
Without much success.
No. You think it worked better here?
Not really. But the alternative is death.
Ex vivo surgery involves the removal of as many as 6 abdominal organs from the body, so that any cancerous tumors can be excised. The organs are then either re-implanted into the body, or replaced by healthy donor organs.
The biopsy confirmed that the kidney cancer is a renal cell carcinoma.
Cancer. I have
Okay. So, Doc, let me share to you about this one. Can you tell me about this ex vivo surgery? This one, ex vivo surgery. What can you say about it?
Oh, I don't um, I'm not a surgery surgeonist, so I don't know about external surgery.
Okay. So let us go back with okay. That's okay, doc. No problem at all because it has been explained here. Okay. So this one. According here, ex vivo surgery. Oh, sorry. Involves the removal of as many as 6 abdominal organs from the body so that any cancerous tumors can be excised. Okay. So this one. It is the removal of an organ
Oh, yes.
and have
Actually,
surgery outside. Okay. Now, Doc, I have a question about this one. Mm, do you think this is not do you think this is susceptible to blood loss? Okay, this one.
oh, yes. I think the
Mm.
person need to accept the risk the risk of blood loss, but they can blood transfusion.
Blood transfusion.
No worry. Yeah.
Yeah, okay. So, blood transfusion. Okay. Doc, next time, let me put it here. Next Tuesday, do you want to talk about bloodless surgery? Let us watch a video about it. Let us watch a video about it. Are you
Yeah.
okay with it?
Yeah.
Okay, so I will put it here. Bloodless surgery. Okay. Okay. Now, do let us go now to the questions that I am going to ask to you because the video is already done. Okay. So this is my schedule and we're going to have a question and answer. Okay. Ooh, this is for you, Doc. Okay. Let us now go here. Okay, now let us go to the very first question. Hmm, Okay, okay, this one. Let us see. Okay, this one though. What are the key differences between normal cells and cancer cells? What do you think?
Oh, normal cells is a healthy, and cancer cells is cancer is not the prognosis is not excellent.
Mm,
Cancer cells, there are many differences between normal and cancer cells, such as uh, the malignant cells is uh, can't be controlled.
mm,
They are cannot be controlled. They develop and not not stop, and uh, they are alive develop but not but not continuous, but not stop. Yes, and they
mm,
split and metastasize almost the organ and the body.
Okay, okay.
But
Thi-
yes, the normal cells will develop and die in a
Ah,
timely, yeah,
mm,
controlling.
healthy cells die
Yes,
in um
on
in,
time.
on time. Okay. Okay. Wow. That's
Die
a
on time.
very Okay, that's new information to me. Thank you very much, Doc. Okay. Okay. Now let us continue our next question. Okay. Mm-hmm. For this one, let me paste it here. Okay. How do mutations in oncogenes and tumor suppressor genes contribute to cancer development?
Oh, um, there are many uh, many uh, uh, information, but not good
Mm-hmm. Okay, Doc. No,
yeah, but
yes.
uh, there are many hypotheses in in the way start oncogenesis and tumors genes,
Mm,
but yeah, and but there are no the good the good explain about this.
okay, okay.
But in it's a mechanism. The body always have a a gene oncogenes and oncogene oncogenes, yes. But
Mm,
they are don't action active, but they are not active. Um, in a um, in a several time they could be started.
okay.
Yeah.
So, wow, that's a good, that is a new idea. Okay, for me. Thank you, Doc.
Mhm. Yes. Aging. Drug. Um. Uh, um. Uh, Chemistry. Radiation. And some some risk, some risk uh, are 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 uh, factor to start oncogenic
Okay,
aging.
okay. Aging. Okay. How
Yeah.
about this one, Doc, about the stem cells?
Oh,
Mm,
stem cells is 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 healthy and uh, is blood is a blood cells.
mm,
Yes,
blood cell.
blood cells
Oh.
in a in a blood and in a so bone
Okay.
bone bone bone
Bone.
bone bone.
Stem cells are blood cells.
Yes, blood cells
Mm,
um
from the bone.
from
Marrow?
bone marrow or or blood in the vein.
Mm,
There are and in the uh okay.
okay, okay.
Yes, and in the baby, the born baby, newborn baby, gọi là umbilical cord of
Mm,
newborn. Yes, and there are two. Yes, umbilical cord. And there are two. The stem cell who collected from three 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 the three straws such as blood in vein or marrow bone marrow or umbilical cord. Stem cell can many characteristics to recover and to come back home and to develop to organ and tissue. Yeah.
Okay, okay.
Skin, bone, or liver,
Yes.
arthritis, collagen,
Oh,
and blood and brain. Yes.
brain. Oh, from
Yes.
even from brain?
Yes.
Oh,
Many stem cells in the blood can develop to become organ or tissues or other cells.
okay.
Yes.
Okay, thank you very much, Doc. Those are really new information. Okay, so now let us continue to the next part of our class. Let me bring you there. Okay, this one. So, based on what you said, Doc, stem cells are they are very healthy cells.
Yes.
Yes, they are very healthy cells. Okay. Others are even using it for to look really young.
Yes.
Yes, okay, okay. Now let us
Very young, very young. Yes, yes, very young.
yes, to look very young. Okay. So now, Doc, I'm going to bring you to our next video. Let me show you. Okay, this one. Oh, Doc, let me share my screen, please.
English class at the clinic.
Hello. Hello. What can I do for you today? I would like to see Dr. David. Do you have an appointment? No, I don't. Dr. David is busy with a patient. If you want to see Dr. David, then you need to make an appointment. Okay. I would like to make an appointment. Can I have your name and age, please? My name is Kate. I am 23. And what is your diagnosis? I think I have a fever. Here is your token number. Please wait in the waiting hall. I will let you know when your turn comes. Fine. Thank you.
Token number 23.
Miss Kate. It is your turn. Please go to the doctor's room.
Hello, Miss Kate.
Hello, doctor.
What is the matter?
I have a fever. I am not feeling well.
Let me examine you. You have a mild fever.
I feel terrible.
Let me check your blood pressure level. Roll up your sleeve. Your blood pressure level is fine. 120/80. No need to worry. I am prescribing you some medicines. Here is the prescription. Take 2 tablets thrice a day.
With meal or without meal?
After having meal. You can take your medicine, and have some rest after taking the medicine.
Thank you.
Get well soon.
Hello.
Hello. What can I do for you?
Give me these medicines according to this prescription.
Okay, Mom. I will be right back. Here you go.
Thanks.
How much is this medicine?
It costs $8.67.
Here you go.
Here is your change.
What's the matter?
I have a cough.
You should have this cough syrup. You will feel better. What's the matter?
I have a headache.
You should rest. What's the matter?
I have a fever.
What's the matter?
I have a cold. I can't stop sneezing.
What's the matter?
I have a backache. I feel terrible.
What's the matter? I have a chest pain. I am not feeling well.
You must go to the hospital right away. It can be a heart attack.
What's the matter?
I was dancing. I broke my arm.
I'm so sorry to hear that. Get well soon.
What's the matter?
I have a stomachache. I ate a lot.
You should take a walk and have some soda.
What's the matter?
I broke my leg. I was playing football and fell down.
That's terrible. God bless you. What's the matter?
I have cholera. I feel dizzy.
Sickness vocabulary.
Cough. I have a cough. Headache. I have a headache. Fever. I have a fever. Cold. I have a cold. Backache. I have a backache. Chest pain. I have a chest pain. Broken arm. I broke my arm. Stomachache. I have a stomachache. Broken leg. I broke my leg. Cholera. I have cholera.
Medical vocabulary.
Crutch. Thermometer. Stethoscope. Blood pressure monitor. Syringe. Stretcher. IV. Test tube.
If you love this video, please subscribe to our YouTube channel and watch this next video. I know you are gonna love it.
Okay. So, Doc, let me ask you some questions now. Okay. So, what part of the video interests you? Mine is about cholera. Okay. How about you, Doc?
Yes.
What kind of disease?
Okay. I like cholera. Yes. Peta of cholera.
Okay. Doc, can you discuss to me about cholera? Is it is it um is it existent? Is it existent in Vietnam? This one?
No. Yes. Cholera is is infection disease in Vietnam.
Oh.
Yes. Sometimes it's up it's broken.
Oh, is that so? Okay. So, Doc, can you tell me what are the other?
Epidemic. Sometimes it's epidemic in Vietnam.
Okay. Oh, okay. Doc, can you tell me please what are the other causes of cholera?
Sorry, on person.
Mm-hmm.
Can you repeat your question?
Oh, sorry. Let me share my screen for that. Here, this one. What are the usual causes of Cholera. This one.
One caution of cholera is bacteria.
Oh.
It names Vibrio cholera. Vibrio cholera is a bacteria. Is cause cholera. Yeah. This bacteria is a huge infection. Disease. Ingestion disease. Yes. When the patient have a food there's have bacteria. It has acute infection. They often stomach vomit, nausea and vomit. Him and the person often diarrhea so much. Yes.
Oh, okay.
And she's or he has fever.
Fever. Okay, okay. So now, Doc, I will go back to the video in this part here. Let me show you this one.
Back. Here you go.
Thanks. How much is this medicine?
It costs $8.67.
Here you go.
Here is your change.
What's the matter?
I have a cough.
You should have this cough syrup. You will feel.
This one. Okay, now let us discuss about the other one. About first the pharmacy. Okay, so Doc, what is the usual way of giving prescriptions? For example, prescriptions for your patients. This one. Oh, sorry, patients. Okay, this one.
Oh. Pharmacist is still with the patient if they have that question. Yes. Yeah. Yes. Pharmacy is hospital. Is give medicine if the patient have that reason and and if the person have a prescription.
Oh.
Yeah.
Oh,
We they don't permit. They don't be permitted to prescription.
oh, okay, okay. So, you need to have prescription to have the medicine.
Yes.
Okay, okay. That is noted. Okay, thank you very much, Doc. Now we are here to vocabulary describing pain. Okay, let us watch this now. Medical English, this one. Oh, for a while, Doc, let me go back there. Let me explain this one first, Doc. Okay, so we usually have advertisements in the videos because we are using free YouTube. Okay, this one. Okay, that's why we have advertisements. Okay, so now let me bring you to the next one. I cannot go to the video right now. Medical English. Oh, this one. Okay, okay, okay. So we are both there. Let's go here first. Okay, this one.
Do you want to know a secret to medical English terminology? Well, knowing common prefixes and suffixes can help you
We are already here, Doc. Okay, this is all about medical conditions. Let me show. Medical conditions. Medical conditions. Here, this one. Okay, let us watch the video now. Okay, here, medical conditions.
understand so many medical terms, and I'm going to show you today with medical conditions. Hello, my name is Giao. I'm from Specialist Language Courses. We are the world's leading medical English provider. And we are here to help you improve your medical English so you can succeed in your career in English. Let's start with a quiz. Do you know what these common medical suffixes mean? The suffix "-tis" means A. Paralysis, B. Stroke or seizure, or C. Action of spitting up.
What's your answer here, Doc?
Oh, A.
A, okay.
The answer is C. Spitting
it's
up.
C.
For example, hemoptysis. The suffix "-oma" means A. Tumor, B. Stricture, C. Disease. And the answer is A. Tumor. For example, carcinoma. The suffix "-itis" means A. Rupture, B. Deficiency, or C. Inflammation.
C.
Letter C.
And the answer is C. Inflammation. For example, appendicitis.
Appendicitis and the appendix.
There are lots of suffixes commonly used in medical English terminology. Do you know what they are? What is a suffix? It's a word part added to the end of a word. For example, itis in appendicitis, oma in carcinoma, or osis in endometriosis. And what is a prefix? It's a word added to the beginning of a word. For example, hemo in hemoptysis, hyper in hypertension, and pre in prenatal. And we can put together a prefix and a suffix to make a medical term. For example, hemo relating to blood, ptysis meaning spitting up, hemoptysis, the spitting up of blood. Let's do another one. Appendic meaning appendix, itis, inflammation, appendicitis, inflammation of the appendix. Can you think of any more medical conditions ending in itis?
Doc, we have a question here. Can you think of any more medical conditions ending in itis?
Yes.
This one, let me translate this. Okay. Can you give me a medical condition ending in itis? This one?
Oh, laryngitis.
Oh, yes, that's right. Laryngitis.
Yeah.
Laryngitis. Let me check. Laryngitis and what's the other one, Doc?
Bronchitis.
Bronchitis. Yes, that's right. That's right. Okay, thank you very much for the very good answers. Now let us continue.
Let me know in the comments. Do you know these? Bronchitis, inflammation of the bronchial tubes. Gastroenteritis, inflammation of the stomach intestines. Cystitis, inflammation of the bladder. Carditis, inflammation of the heart. Vasculitis, inflammation of the blood vessels. Myelitis, inflammation of the spinal cord. Here is a list of some of the most common suffixes for medical conditions. As you can see, we've got emia, meaning blood condition. For example, anemia. Lepsy, sudden seizure or attack, for example, epilepsy. Pathy, meaning disease, for example, neuropathy. Penia, meaning deficiency, for example, leukopenia. Plasia, meaning formation development, for example, hyperplasia. Reg, excessive flow, for example, hemorrhage. Rhea, flow or discharge, for example, menorrhea. Can you think of any more? Let me know in the comments. So, look at
Okay. Let us go here first, Doc. Can you think of, there are words here. Let me go back. Okay. So among the words here, Doc, which one here? Among the words, which one is commonly used in your field? Okay, this one. Okay. I will go back there, Doc. This one. Which one is commonly used in your field?
Okay.
This one is the question, Doc.
Trong số những từ mà một người thường được sử dụng trong lĩnh vực của bạn.
Let's go back there. Here. Which one is usually used in your field?
Anemia. Leukopenia.
Leukopenia.
Yes.
Okay. Yes. Okay. Deficiency. Okay. Thank you very much, Doc. Let us continue.
flow or discharge, for example, menorrhea. Can you think of any more? Let me know in the comments. So, look at these suffixes. Now, can you match the terms to their definitions? And here are the answers.
Okay. This is for number 1. Okay. Can you give me the answer for number 3, Doc? I'll wait for you.
Oh. Left side. Scissor or opposite, yes.
And then let's go to number 4.
The vaginal spasms, which because because isthmus spasm, isthmus.
Yes. Okay.
Vaginismus or vaginismus.
But vaginismus. Okay. And then let me check number 5. Okay, this one. Yes, that's right.
Before we continue, if you want to know more medical conditions in English and for more activities like these, check out our course, Medical Terminology. Back to medical conditions. Can you pronounce these? To improve your pronunciation, mark the stress syllable and practice. For example, here, vasculitis. Now you try. Listen to these terms. Which syllable is stressed? Cardiomyopathy, epistaxis, hemoptysis, hemiparesis, homeostasis, leukopenia, narcolepsy, osteomalacia, vaginismus. Now listen and repeat. cardiomyopathy, epistaxis, hemoptysis, hemiparesis,
Hemiparesis.
homeostasis,
Homeostasis.
leukopenia,
Leukopenia.
narcolepsy,
Narcolepsy.
osteomalacia,
Osteomalacia.
vaginismus.
Vaginismus. Okay.
Want to practice these terms and more? Check out our course, Medical Terminology, full of activities to develop your knowledge of medical English terminology, including pronunciation and downloadable glossaries. Now I've got an extra activity for you. I'd like you to let me know a medical condition. Can you create one using one of the suffixes we looked at today? And congratulations on getting to the end of the video. We've got a surprise gift for you. If you comment medical in the comments below, we'll send you a link to a free handout, a glossary of medical terms from today.
Okay, so there we go. Now, among the medical terms, which one is usually used in hospitals? Okay, this one.
Actually, many terms, many words, because the words the medical words often related from Latin. Yes.
Oh, okay.
Yes. And then also almost words is medical book is different from English.
Okay, that's why. So, for
It's not
example,
popular,
oh,
not popular in yeah, yeah.
mm,
Talk,
it is not popular.
yeah. What's
Yeah.
medical? What's in from Latin?
Oh, okay. So there is a mention there of the word, I think this is really close to you as well, Doc, because this is related to blood. The word is hemorrhage. Let me
Yes.
check my spelling first. Okay,
Yes, bleeding.
hemorrhage. Now, what can you say about hemorrhage? When does this usually happen? Okay, this one.
Um, hemorrhage it appears when the ham the vein or vein or vascular harmful this broken. Yeah.
Okay. That's right. So does this happen to brain as
Trauma,
well?
surgery, yes. Trauma or surgery, um, cut, cut, cut in the organ.
Okay. That's it. It's really dangerous to have a brain trauma.
Yeah.
I
Yes.
once knew someone that bumped,
Brain trauma.
yes, post, and there is no blood because it was an internal bleeding.
Uh,
Yeah, it was really too much.
uh, yes.
Okay.
Brain trauma.
Brain trauma is really dangerous. Okay. Now, we are going to continue to the next video. Doc, for this one, I think this will be our last video for today. Let me just put here first. This is March 2, 2025. And then we have here discussing diagnosis. Okay. So today we're going to talk about discussing diagnosis.
Yes.
Yes. Okay. So when discussing diagnosis, when discussing diagnosis, what do we usually need to take note? This one.
Um. Uh.
Take this one. Note.
I think no, I I think diagnosis the we need give a diagnosis about I think we need diagnosis the cautions and condition and yes caution yes yes of disease.
The condition of the disease.
Yes, and the
Yes.
caution, the cautions.
Caution? Caution, doc? This one? Okay. I'll wait for you.
Reason, the reason of the reason of disease.
Okay. The
Yes.
cause.
Cause.
Yes, the cause of the disease. Okay, that's good. Okay, now, Doc, I will bring you to this one. Let me show you medical English explaining. Oh, this is only for. Okay, here.
Knowing the right phrases to use when giving a diagnosis can be difficult. So in this video, I'm going to show you some phrases that you can use. Hi, I'm Jo from Specialist Language Courses. We are the world's leading medical English provider. And we're here to help you with your medical English so that you can succeed in your career in English. So what might you talk about when explaining a diagnosis to a patient? Causes, prognosis, progression, treatment, medication, and advice or recommendations. First, let's take a look at some vocabulary related to diagnoses. Active management, cure, drug therapy, palliative care, conservative management, diagnosis, palliation, prognosis. Do you know what these words mean? Match them to their definition.
Okay, so, Doc, you may match them. No need. Number one, treatment which aims to avoid invasive or radical therapeutic procedures. May I know your answer?
Yes, I match three. I match three.
Yes, what letter, Doc?
Yeah.
For number one?
Three.
Letter C?
Number three, yes. Oh, no. I match.
A, okay.
I match three.
Let me just delete that, please. Okay, this one. Oh. Okay, here. Let me put a pause so that we can answer this first. Okay. So for letter number one, your answer is letter A.
No. A match three.
Oh,
On
like this one.
yes
Okay, okay.
on one match yeah, um uh D or E D.
Letter B is what number?
Um, pronounce it. Uh, 5.
5. Okay. 5. Okay. Now let's go to letter C.
Yeah. C. Active management. Yeah. Active management. 2. C. Match
2.
2.
Use of medicine, surgery, and other therapeutic means to cure disease. Yes. Okay, let's go to letter D.
I think D. Uh, 1. D. 2 1.
Okay, number 1. Okay.
E. 2 6.
6. Cure, successful treatment of a disease condition.
Yeah. And F 2 F match 2 4.
Number 4. 4? Okay. Now let us check the answers for a while, Doc, please. Okay, this one. Okay.
And here are the answers.
Oh.
Diag
Okay, diagnosis. Let us listen. Here.
Diagnosis, determination of the causes of a disease by assessing signs and symptoms. Prognosis is the forecast of the probable course of a disease or condition. Active management is the use of medicine, surgery, and other means to cure a disease. Conservative management is treatment which aims to avoid invasive or radical therapeutic procedures. Cure is successful treatment. Palliation, the alleviation of unpleasant symptoms without being able to cure the disease or condition. So what language should you use when discussing a diagnosis with a patient? Let's take a look. For giving a new diagnosis, from what I can see, I believe you might have something called pneumonia. Based on what you've told me, it could be diabetes. It looks like you might have a urine infection. Explaining test results. I have the results of your blood test. The results have ruled out pneumonia. The results indicate high cholesterol. Explaining medication. I'm going to prescribe a medication called a statin. I'll also start you on an inhaler. Sometimes you need to give bad news. What phrases could you use? Let's take a look. I'm afraid the news is not as good as I had hoped. The endoscopy you had last week indicates that you have stomach cancer. I'm afraid it's already at an advanced stage, so the prognosis is not positive. Unfortunately, it won't be possible to treat it, but we can try to slow the cancer down. I know it's a lot to take in, and it must be a shock.
Okay, so let us go here first because we have 1 minute left. Okay, so Doc, how, in your experience, how do you usually give bad news to your patients? This one.
Hmm. Uh, I think I often give bad news uh, to family of patient.
Oh, family members.
Yes, family members of patient. So, and we and then we give not give bad information to person with uh, with family member. Yes.
Mm,
Yes.
okay.
Yes.
So sometimes it is hard to discuss to them about the bad news, right?
Yes.
Mm,
Always, always, always is hard.
yes. Okay. So,
Mhm.
Doc, how's the class today? Is the duration okay with you?
Yes.
Oh,
Good.
okay. Let me discuss to you some things first. Okay. Is the duration okay with you? Do you have any suggestions about it? Mm-hmm.
Oh,
This one?
I think okay, okay. I am not a solution.
Oh,
uh,
okay. Okay.
we can we can start my lesson. Yeah.
Oh,
Yeah.
okay, okay. So thank you very much for your patience today, Doc. Thank you for your patience. And I will see you again this Tuesday. Okay.
Thank
Thank
you.
you very much, Doc. Bye bye.
Bye bye.
Bye bye.